important aspect of integrated medicine. I have a distinguished panel which will address so many aspects of integrated medicine. Just to put a few thoughts in the minds of the audience that, in these schools across the country, I'm sure students, young MBAs are looking at the success story of Patanjali versus major FMCGs across the country. And it's not rocket science for many of us in India to understand the key success of Patanjali is based on trust. Trust because of traditions and legacy. We really believe that Ramdev Baba and the product what he represents, the entity what he represents, Patanjali, has got some of those, what do I say, secret ingredients which somehow promotes healthcare. I'm just putting a thought out there that's a lot of trust across the length and breadth of the country which is driving consumer behavior towards Patanjali. That's one aspect of it. Second aspect of it is that it is agnostic to change in governments, that this entire space of integrated medicine has been talked about and debated for the past few decades. And we are perhaps at an inflection point as a country. In light of the previous sessions, discussions on the cost of care, can alternative medicine and integrated medicine really shows the way? That's the second point. Third is that thanks to Doklam and what's happening in the northern borders with China, if you just cross the Himalayas and look at Chinese hospitals, one would be surprised to see that how is China so able to finally balance between modern medicine and traditional Chinese medicine within the same entities in most Chinese hospitals. And they've got very good governance systems in place. Is there a lesson which we can really look up to our Chinese friends across the border and ensure that modern hospitals in India also pick up some elements of that? That's the third aspect. Fourth aspect is that many of us sitting in this audience here, like I've noticed that some of us had this upper respiratory issues. And I also found that many of them are chewing on the Himalaya products, cough lift lozenges. And I also realized that some of them are having cough lift syrups. And, this is also coming into the aspect of traditional. It's a massive opportunity out there in terms of traditional medicine and its offerings for the country. So to set up the context, and I could say from personal experience that I am the CEO of Aster DM Healthcare for the Kerala cluster and for Hyderabad. And I also happen to run one of the most interesting hospitals in India today called Aster MedCity. It's a Joint Commission accredited quaternary care hospital. But my special pride is that we have a center for integrated medicine where we have a 15-bed center focusing on Ayurveda. And we have a panel of modern medicine advisors, mainly from neurosurgery, orthopedics, chronic disease management, and our Ayurveda colleagues. And, we started off with 15 beds, and it's 100% occupancy. For, the demand for integrated medicine is quite high. So, and we are not the only provider of modern medicine going into the integrated medicine model. Several others are also coming into this space. So, this space is bound to expand. My last comment, which my esteemed colleague Dr. Puri would also shed more light, is that because I am from Kerala, we have a strong tradition of Ayurveda. Many of us, it's just a left-right brain aspect that we naturally reach out to traditional medicine, or you can call it grandmother's remedy. It's got real personal benefits in terms of well-being. Just few weeks back, monsoon comes to the subcontinent. 1st of June, it clockwise hits Kerala coast. And a few weeks back, we have an interesting time of the year, which is called Karkadagam in Malayalam. It's the year, the month of the year where the ecosystem, the environment is perfect for going for rejuvenation therapies. And when you look at some of the centenarians back home in Kerala, or people who are pushing 90s and still in robust health, they do this clockwise, that every year they go for this rejuvenation therapy, where your diet, the kind of discipline which you bring to life, it's not just your physical re-engineering, it's also mental re-engineering, which brings you up. So this is an overall context of the discussions we are going to have. The opening bat for our discussion is Mr. Franklin Kobunk, who is an administrator, and he is currently the director of Ministry of Ayush, Government of India. From a regulatory perspective and from a prescriptive point of view, Mr. Franklin would tell us the current status, that what is the government of India looking at this space and what is the way forward. So, Mr. Franklin, over to you.
Thank you very much, Mr. Pillai. The subject given to me is regulatory policy. That's basically the regulatory framework that is in place as of now for the promotions of Ayush system of medicine and its applicability in the public health care. Holistic healthcare is something which has become one of the most frequently used vocabulary in the public health scenario. Holistic healthcare, we all know that it can be achieved only by way of integrations of different system of medicines, that is modern system of medicine with the different alternative systems of medicine, which is popularly known as Ayush in our country. Integrations of these different system of medicine to achieve that ideal holistic healthcare finds a mention in our national health policy also. And we also have, as we all know, that national policy on Indian system of medicine also. They do talk about integrations of these different system of medicines for the benefit of public health, and also the way forward. The steps which the government has to take in order to achieve this. Presently, the government of India, under the Ministry of Ayush, in convergence with various schemes of Ministry of Health and Family Welfare, is undertaking different programs to achieve this, especially in public health. I would like to, just for your knowledge, give you a few of those steps, initiatives which the government is taking. We may be aware of the premier health scheme of the Ministry of Health and Family Welfare by way of National Health Mission. We in the Ministry of Ayush also have a flagship centrally sponsored scheme by the name National Ayush Mission. So we, in convergence with the National Health Mission, we try to have Ayush units in all the public health facilities, from primary health centers to community health centers to district hospitals to major hospitals, government hospitals across the country. We from the Ministry of Ayush provides capital expenditure as well as the needed medicines, equipments, etc. from the National Ayush Mission. And the National Health Mission provides for manpower support and also equipments and other contingencies that are necessary for the co-location. So under these co-location programs, we intend to achieve at least co-locating Ayush facilities in 40% of all the public health facilities with the convergence of National Ayush Mission as well as the National Health Mission. And presently, about 27,000 Ayush doctors are participating actively in all public health activities in the public health facilities. Also, we have a scheme of setting up integrated hospitals which will have facilities both for the modern medicine as well as the Ayush system of medicines. We also have taken up initiatives with Ministry of Defense, because Ministry of Railways, because they have good setup for healthcare. ESI is also one big organization that is contributing to healthcare. We are taking necessary initiatives with them to have Ayush facilities in all their centers. That is also one big leap, I think, which we have achieved. As far as the regulatory part is concerned, the Ayush system as such, Ayush is an acronym of Ayurveda, Unani, Siddha, Sovarikpa. Sovarikpa is the Tibetan system of medicine, and of course homeopathy, yoga, naturopathy. The Indian system of medicine is being regulated by a legislation called Indian Medicine Central Council Act, and homeopathy by legislation called Homeopathy Central Council Act. These acts are being formulated in the lines of MCI Act, the Indian Medical Council Act. Basically, they are the Xerox copy of the Medical Council Act of India, and accordingly, we have the Central Council of Indian Medicine on the like of MCI, and Central Council of Homeopathy in the like of MCI only. So these are the regulatory councils that regulate the practice and education of the Indian system of medicine as well as homeopathy. Accordingly, the ministry, in order to achieve this kind of integrations of this different system of medicine, few years back have mooted the idea of having a bridge course. Basically, that is on both the sides. Basically, that is to design that kind of course for doctors of one system of medicine to get familiarized with other system of medicine, to undergo those courses. Duration can be 1 to 1.5 years. And that was rigorously pursued with, but then till date no outcome has been achieved because of certain hiccups which we face in the process. For example, for Ayush doctors to practice modern medicines, they have to undergo that bridge course, which has to be approved and vetted by the Medical Council of India. But we get certain, objections from the Medical Council of India, and also certain directions even from the judiciary side also, saying that until and unless the regulatory council vet and approve such kind of courses, nobody can become legal practitioners of the system of medicine. We all know that medical education, public health is the state subject, but medical education is in the concurrent list. So the central government of India has the final say as far as regulations of education and practice is concerned. So until and unless the central regulatory authorities by way of MCI, by way of Central Council for Indian System of Medicine and Central Council of Homeopathy jointly agreed upon and vetted those courses for inter-service, system practices, then basically this cannot become effective. Few states have experimented by way of amending their state act, but there is a Supreme Court judgment also, and the provision of the act is very clear that until and unless the Central Regulatory Council, which is the supreme authority for regulating education and practice of this kind of medicine, they agreed upon that, it will not stand in the eye of the law. So that is the current situation which we are in now, as far as the having a combined course is concerned. Mr. Pillai talked about the Chinese model. The Chinese model, we know that it's very successful. But it is successful because they have a course that is common. A common course has been designed, and there is a common council that regulates both the Chinese traditional medicine and the modern system of medicine. With regards to the way forward, the government, both the ministries, are really definitely pushing on the integrations of this different system of medicine. So presently there is an initiative which is being taken up by the ministry in consultation with Niti Aayog to formulate a new legislation for both Indian system of medicine and for homeopathy, which is not yet finalized as of now, but that Act do have a provision for having a joint forum of this different system of medicine, the regulatory council and the concerned authorities to have a common platform to sit together and to work for integrations of a different system of medicine. What we feel is that this integration, actual integration there in the field will take place when there is acceptance of each other systems of medicines between different practitioners of different system of medicine. Once that acceptance is there, I think then only we will achieve the real integrations of, in the real sense, which will be benefited by the public. Many instances, what we have seen is that when a patient goes to an allopathic doctor, even in a hospital which have different system of medicine, there is some reluctancy for that doctor to refer him to other system of specialist of other system of medicine. So that has to be overcome. Until unless that is being seen and we adopt that attitude, I think that we will not be able to achieve this integration in the real sense of the word. Thank you so much.
That's a very good point, and to dwell more on this matter about acceptance, knowledge, skepticism, cynicism, whatever isms we talk about, none better than Dr. K.K. Agarwal, who's our national president of IMA, and I would consider him as a walking encyclopedia on traditional medicines too. So, Dr. Agarwal, over to you.
Thank you, Dr. Harish. There are two subjects. One is integrated medicine. Second is naturopathy and yoga. The two are separately altogether. So I'm going to cover naturopathy and yoga maybe in the second half, because we were supposed to have two halves. But this integrated medicine, we need to understand the concept. And I want to be very basic into this to define what integrated medicine is. The universe is made up of 5 elements: the air, space, fire, water, and earth. Any disturbance in that atmosphere, we call them as flood, we call them as volcano, we call them as tsunami. Okay? And when you balance these 5 elements of the nature, using the 5 elements, we call them as nature cure, naturopathy. Sun therapy, water therapy, fruit therapy, natural fruits, natural vegetables. We call them as basically as naturopathy. Now these 5 elements also forms my human body. And these 5 elements in my human body makes 3 functions. So if somebody asks me what is a human body, we say something which moves, something which has a metabolism, and something which has a structure. So movement, metabolism, and structure is my body. Ayurveda people call them as Vata, Pitta, Kapha. The homeopathic people call them as Sora, syphilis, and psychosis. And Ayurveda also call them as a mental humor called Rajas, Tamas, and Sattva. Now balancing these 3 movements, the movement, metabolism, and structure, as on today is the domain of Ayurveda. This is Vata pacifying lifestyle, Pitta pacifying lifestyle. Now these 3 movements in my body makes 7 tissues in sequence, and that is Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra. Plasma, the blood. Now you say, yes, some allopathy is coming. We say Rasa, plasma, blood, muscle, adipose tissue, bone, bone marrow, and immunity. Balancing these 7 dhatus is again Ayurveda. Because today we have there is some mix of modern medicine with Ayurveda here. Now these 7 dhatus in my body, they make 3 essence: the prana, the tejas, and the oja. Tejasvi bhava, ojasvi bhava, we only see it in the TV, but then again is the essence of Ayurveda and it's essence of Vedic medicine. And then comes the receptors. There we say, yes, my modern medicine is coming. At the level of receptor, there are medicines which are working at the level of receptors. Now one thing everybody should remember, that the receptor is like a lock and a key. The receptor is like a lock and a key. And the very fact there is a lock, there is a key. My God never made locks in my body, receptors in my body for pharmaceutical companies to come and make the keys. The very fact I have a lock, there is an inherent capacity to produce that key. Therefore, I have an inherent capacity to heal everything. That is the fundamental principle of when I talk about integrated medicine at all. Now, when it comes to receptor, now I need to understand some principles of matter and non-matter. Atom, when I break the atom, it divides into subatomic particles. And when I divide subatomic particles, then I will get proton, electron, neutron. When I divide that, it will become photon. And after photon, boson. After boson, quantum. Then energy, then wave, and then shunya. That shunya science is yoga. That energy science is homeopathic energy medicine, which they talk about. At the level of photon, I need to understand the principles of quantum physics. That at the level of photon, the substance from local becomes non-local. And that is called spooky action at a distance. Therefore, at the level of photon, the drug's characteristics changes. It becomes a different drug. And that level, in Ayurveda, they call them as bhasm therapy. And in homeopathy, they call that as potentized therapy. At the level of metal, suppose I have this flower. This is a matter. This is a local matter, which I can see. If I use it as it is, this is naturopathy. If I do the chemical analysis and take the chemical out of it, this becomes modern medicine. If I put it into alcohol for 10 days and take the alcoholic extract, this becomes homeopathic tincture. And if I dry it and start grinding it, it becomes an Ayurveda. So the source of the medicine may be the same, but the knowledges are different, the ways of actions are different, the integrations are different. So there is some integration. So homeopathic tincture, some Ayurveda and some allopathy may work on the same principle. In fact, they may be the same medicine. The source of medicine may be the same. But in Ayurveda, I'm giving a action and the opposite action together. But in the modern medicine, I'm giving it only the ingredient out of it. So therefore, I need to understand all these sciences are different. We need to have all these people work together to come out with a new science, because you know the principle of FDC, that 1 + 1 is combined, it becomes a third drug. Similarly, if I combine one philosophy with another philosophy, it will become a third philosophy, and that third philosophy needs to be documented. That's the basic thing we need to understand about various pathies. So they all are working at a different level. It is possible to interact with them. I'll give you a couple of simple examples how Ayurveda and homeopathy and allopathy can work together. Say, when we say movement predominant people will have strictures and pain. And a metabolism predominant people will have ulcers. And a structure predominant people will have growth. So therefore, if a person is developing cancer, if he is a movement predominant, his cancer will be a stricture. If a person is developing if the metabolism predominant person, which can be identified, he will develop an ulcerative cancer. And if the person is having a structural predominance, his cancer will be a cauliflower type of a cancer. So therefore, if I combine two pathies together, if a person who is supposed to get a stricture cancer is curable, but if he is getting a fungating cancer, which he is not supposed to get, they call them as asadhya, and we call them as metastatic, anaplastic cancer, aggressive cancer, is not likely to survive. So it is possible to work together. But as on today, the laws doesn't allow us, the philosophies doesn't allow us, and what is stopping us to work together is that the Ayush people practicing modern system of medicine. Why? In my modern system of medicine, after I complete my pharmacology, I am not allowed to practice. Pharmacology I am taught in the second trimester, in the second prop. After that, I am not allowed to practice for another 2.5 years. For another 2.5 years, I am not allowed to practice. Therefore, after a bridge course, then my MBBS doctor, just after completing pharmacology, should have been allowed. No, it may not be. Integrated medicine basically means we work together, we understand and come out with a science which can reduce the toxicity of allopathic medicines and the duration of allopathic medicines and the need for antibiotics in integrated medicine. That's the need. Regarding allopathy, naturopathy and yoga, I'll come back later.
It's quite fascinating. I'm also tempted to ask you, Dr. Agarwal, that how did you acquire this body of knowledge?
I am a Vedic teacher. I've read most of the Vedas. I can trace the Atharvaveda and the whole Vedic sciences into modern medicine. And my basic concept is that every ritual, every religion, every Vedic sciences, I trace back to the Vedic knowledge. And Vedas are the origination of Atharvaveda. From Atharvaveda, the Ayurveda comes. But if you read Samveda, Yajurveda, and the Rig Veda, you get all the essence of allopathic answers.
You know, for the past at least 3 years, we have at least now one day where we celebrate the International Day for Yoga. And it's remarkable that we have our present Prime Minister who has really pushed forward the agenda of declaring this as an International Day of Yoga. Many times I keep wondering that do we have to have a validation from the outside world to what is really gold and nuggets which is in our own backyard. The point I'm trying to make is a few years back I had the opportunity to visit the Thomas Jefferson University in Philadelphia, where they have an enormous unit for integrated medicine, and they have an fMRI which is located there for cutting edge research at the therapeutic aspects where traditional medicine can impact health and well-being of people. So the next speaker, Dr. Ram, is going to dwell upon the current status of research, and those of us who may not understand the principles of traditional medicine or Ayurveda and its impact on well-being. So if you can take off on that subject.
So that was a fascinating overview of how integration could be made possible at a conceptual level. And yes, it's very heartening to see this perspective of how to bring very diverse epistemologies, together and make sense of how different approaches understand the human body. But I'd like to look at integrative medicine more at a practical level and also define, the meaning of evidence in terms of, how we have to generate it when we're looking at integrative medicine at the practical level. I think the meaning of evidence also changes depending on how we define integrative medicine. If you look at it, for a lot of people, integrative medicine also means cross-system practice. One practitioner understanding something about the other system and then incorporating it into his own practice. And on the other hand, we can also look at integrative medicine as collaborative medicine, where practitioners of independent systems come together, for providing better care to the patient. So I think this is definitely should be the way or the future of integrative medicine. It should basically be collaborative, because for the very reason that these medical systems require, like Dr. Agarwal was mentioning about the pharmacology example, it requires very deep and intense training and understanding. And what we should really look about is communication, effective communication across medical systems that will allow for collaborative work. And the focus of this whole collaboration has to be the interest of the patient. I mean, how can better care be provided? And in this context, I think that evidence is an inevitable or very indispensable component of this dialogue. I mean, we should look at evidence in that way. I mean, evidence should be able to facilitate this communication. So this is very different. The problem has always been that, systems like Ayurveda has been forced to kind of provide evidence of proof, primary evidence of proof, whether it works and whether it is valid. I think the whole situation has to go beyond that. I mean, these systems are valid by themselves. And of course, we have to work on self-validation and, its own self-development. But when it comes to integration, it's more about communication. And when we look at evidence as communication, then the whole perspective, changes. I mean, we're really in need of a universal language in which people dealing with the kind of, diverse epistemologies can make sense of what is, best for a patient in a given situation. So I think here, evidence building itself is a method of dialogue. I'd like to give an example. I mean, I was involved in a National Institutes of Health USA funded research study, which was perhaps the first attempt to see whether in the context of a clinical trial, there could be a very serious dialogue between practitioners of modern medicine and Ayurveda. I mean, in this trial, the modern doctors who participated in the trial wanted to ensure that we have an extremely rigorous model, a double-blind RCT clinical trial, which was even with placebos. Whereas the Ayurvedic physicians were very keen that they would not be asked to modify the methods of their treatment. Like, it had to be person-centered, individualized, holistic treatment. So this was a trial in which, these two seemingly impossible ends were attempted to, be brought together. And this study was very interesting because it turned out that it was successfully conducted. I mean, I'm not going into all the technical details of it, but this was a study which was able to really achieve this purpose of, having a dialogue, because the bottom line of the whole study was, we found, although it was a pilot study, that the individualized, in this trial, the Ayurvedic physicians were able to give individualized treatment. They could modify it based on their responses. But still the whole design was a randomized controlled trial, which was placebo controlled, which was blinded, where all the, the modern parameters, outcome measures were included. And the final outcome was that it was found that Ayurvedic medicine, in the longer run, was approximately equivalent to methotrexate, which fewer side effects. And this study was published in the Annals of Rheumatic Diseases. It's the first time that ever an Ayurvedic paper is getting published in that journal. So, and then also it was presented at the annual meeting of the American College of Rheumatology, and it won an award from the European Society of Integrative Medicine. And also, I mean, I'm talking about this in terms of the dialogue that was possible as an outcome. So I think we have to really look at evidence in terms of, dialoguing and how certain concerns of the two practitioners can actually be addressed. Like at Amrita Institute where I work, we have also started what we call as integrative clinical trials, which is again in the form of this dialogue. Like, the allopathic doctor has a question, we have HIV patients. Can we delay the use of ARTs? Now we have a very clinically relevant question because patients do not want to start on ART. And here we are exploring whether, Ayurvedic treatments can preserve the CD4 counts above 500 so that, we can keep delaying the... So these are examples of how, evidence could be built in the context of dialogue between different practitioners. Similarly, in hepatocellular carcinoma, can progression-free survival and quality of life be enhanced through Ayurvedic treatment after, sorafenib fails? So, similarly, there are other concerns, especially drug-herb interactions. So we have also worked on developing a model right from retrospective analysis of prescriptions, identifying the commonly co-prescribed. Now, when we talk of integrative medicine, I would like to point out, most of the time, the problem of combination therapies is brought forth. But integration is not always about combination. It's also about, identifying where a particular system is more effective and developing an approach that would address the patient more completely. Body, mind, and spirit, as they say. It's not just always combining pharmacologies. But that also happens sometimes. And so, with the use of bioinformatics and the leads from commonly co-prescribed, because this co-prescription is something which is already happening. I would say in India, integration is already patient-driven. Patients are also already doing it. And so we have a lot of data available, which if we can cull out from that, patterns of prescriptions, and then do some bioinformatics, and then postulate some possible drug-herb interactions through in vitro, in vivo studies, we could get a handle about, how these things happen. And so the bottom line again is that I wanted to say that evidence, when it comes to integrative medicine, should be looked at from this perspective on how we look at integrative medicine, and dialogue and communication and how effectively this can be done should underpin all these efforts.
Thanks.
In the second part, I will look into some of the methods.
Just for the sake of time, because I'm not sure whether we'll have time even for a second session, but let's see how it happens. Very interesting points that we have to change the paradigm of research where traditional medicine is concerned. Our next speaker is Rajiv, where he has an interesting set of life stories in terms of challenges and opportunities which this field will offer. So Rajiv, for your thoughts.
Namaste, and it's quite interesting that the earlier session really brought in a lot of introspection about where healthcare is going, what are the issues of value, profits, and you could see from the intensity of the discussions that these are points that pertain in the larger context of healing, patient centricity. Let's take these points, right? So when you talk about heal, quickly, let us understand that heal means not just healing a wound, but it is a more comprehensive patient transformation at the physical, mental, and potentially the spiritual dimension. So are we really talking about, when you talk about healing, can we just go back to the basic definition of where is the mind? This year, WHO has defined depression, has proclaimed depression as the most prevalent cause for disability globally. 50% or something, they've given a number. What does that indicate? It indicates that the role of the mind, whether you're talking about psychosomatic conditions or even more, the fact that people are under increasing stress and the stress leading to medical conditions. So where do we really tackle healing in totality? The fact that when we talk about well-being, right, when we go beyond disease into the well-being definition, which WHO goes back again into that point about physical, mental, social, and so on health, something that Ayurveda 2000 years back had proclaimed, that samadosha, samagnischa, samadhatu malakriya, prasanna atma indriya manaha, swastha atibhidiyate. Means what? A person who is complete in functional health, not just the absence of disease. Now, why do I bring this point? When you're talking about healing, when you're talking about value, we talked about profiteering, profit, all these points. It all comes back to the point of value that the patient receives. Can we define value beyond a ostensible reversal of a disease parameter to the larger well-being that the person gets beyond the disease? So disease cure plus positive health. And therefore, in this context, a system like Ayurveda, which is intrinsically rogi-focused or patient-centric, we don't look at the disease alone, we look at the patient and with the disease is there. A systems thinking approach at the highest level, refined over millennia, brought in. Unfortunately, how it is presented to the modern Indian is quite at contrast to that particular picture. So let's look at integration as the word again that, managed integrated healthcare models. The typical, the options that are considered is a co-located model, a referral model. Co-located is both parties sitting under one roof, but they operate differently. They're like, two different religions. They just don't mix with each other. The other part is a referral system where you could be co-located or you could be at a distance and you're referring from one place to another. That's still a progression in terms of cooperation. Then we come, and this is in the context of adjuvant therapy, primary therapy, secondary therapy, these type of roles being taken. Why is this important, right? I'll just come to that part. And finally, we are looking at in terms of the co-located referral kind of model to what I believe is the future of integrated healthcare models, which is co-managed healthcare, right? Now that's like taking a big leap of faith. So let's look at why this co-management becomes necessary. We have people, typically when you talk about the patient, we got so disease focused that we forget that a patient typically comes with multiple problems. He may be coming for a primary, when I'm looking at emergency, life-saving surgery, it is very clear that is a predominant need for which the patient comes. But we step back and look at a human being, he's got multiple issues. And typically if you look at a patient who comes to some of our integrated facilities, you would find he's got a severe, he may be a stroke patient, he may be diabetic, he may have blood pressure, he may have a constipation problem. How do I tackle this at the whole person level? So we truly ignore that need. And the fact that today only 1/3 of the healthcare demand is represented by the tertiary emergency care. If you look at the larger healthcare demand, 2/3 is for chronic, non-communicable diseases, systemic diseases, right? So this is a reality in front. In different contexts, we talk about the NCD burden, this burden, that burden. But do we look at it at a systems level? What is happening in totality? In India, where is the need? Where is the poor spending money, right? So when you look at this part, multiple problems, systemic problems, the fact that functional health is a major issue today. When I say functional health, sleep, metabolism, excretion, whether you talk about solid excretion, liquid excretion, the clarity of the senses. Simple point, a new terminology called WhatsAppitis will come very soon, because it's not just going to be the mental disorder, it's going to be the eyes which will be affected, it's going to be the ears, it's going to be sleep, it's going to be constipation, the whole body functioning cycle affected by changes in lifestyle, right? So we have a epidemic proportions, lifestyle changes which are happening. How do we tackle it? So in going into it quickly, let's visualize a modern Ayurveda doctor in a modern Ayurveda hospital which is NABH accredited. We have this perception of an Ayurveda physician who's got bhasma here and doing some, nadi pariksha, and the mystical, some personality-centric subjective thing which is cultivated by certain people who like that to be that way, right? Let me go back to the contrary picture, which is of an evidence-based diagnosis, right? Quickly, evidence-based medicine, if you go and check on the net, will be something, one of the clear definitions is something where you're able to refer a clinical problem to a researched, published body of work, right? In Ayurveda, what we have is something which over millennia has been refined and put together. It's a living system. The other definition for evidence-based medicine is something that has been practiced over generations and has proven to be clinically effective. You can see in the last 3 to 4 years some of the publications of the American Heart Association Circulation magazine, where they talk about guidelines today for certain things which are not based on double-blind, randomized clinical trials, but it's based on this thing. So the fact that we have in Ayurveda a evidence-based diagnosis which is based on similar principles like recording all the patient parameters in terms of the presenting complaints, medical history, clinical examination, and a systemic view of the health, what you call roga samprapti or the etiopathogenesis. Lab investigations brought in, standard outcome scales of modern medicine brought in process control charts. Long before Atul Gawande came out with his checklist manifesto, Ayurveda 2000 years back, for every procedure that we do, there are checklists. So the fact is the science is very mature. It is not understood. So in this context, what are the real opportunities for scale? Let me conclude this part with that. Yesterday, Dr. Vinayagam from the Tamil Nadu government said the success that they found in Tamil Nadu was by taking the problem at a systems level, looking at the supply of healthcare, looking at the demand for healthcare, breaking it down, looking at who can serve that better. I think it is time that the Indian industry and Indian government looks at a systemic view of what all these players can happen. I don't know how many of you are aware, we heard about the Karnataka government coming out with trying to regulate the pricing. They also came out for the first time in November, the first integrated healthcare policy in India at a state level, right? So many healthcare practitioners, how do you leverage it? So the fact that 14,000 doctors pass out each year, how do we leverage them? Not to do mixopathy, not to do quackery, but is there a way that we can look at appropriate integration? The economics. Where do people, in the US, Medicare takes care of the treatment post-discharge and through. Longer length of stay, how do we give that? Is there a possibility to do that? The fact that medical travel into India today, right, we are positioned on price. We talked about quality and outcomes, but the fact is price is a very important thing. How do we cater to attracting high value, first world patients coming into India? They would come for best in class quaternary care, tertiary care, as also integrated with something as solid as Ayurveda. So I think this is a huge opportunity. Integrated medicine allows us to provide the best of both worlds. It can be truly India's USP. Sri Lanka trying to copy, somebody else trying to take away, but fundamentally, Indian healthcare can show, like the Cuban healthcare model showed a different way to do healthcare. India, by appropriately doing it, can do this. And I just want to conclude with this section by telling insurance, the way it is coming to back up across the country. There's a huge change. Today, almost all the insurance companies have insurance coverage at the corporate level. And whose audience is a young, upwardly mobile, internet savvy audience who's coming to Ayurveda when he needs, for his and family needs. I think it's a reality that we need to recognize. Customer satisfaction is very high in Ayurveda, and by bringing in this integrated approach, it is the way forward. I will talk about some challenges and things later.
Thanks,
Thank you.
Rajiv. So one lot of keynote messages from Rajiv's thoughts. He also talked about well-being, and we all of us, we correlate yoga with well-being, and I would request Dr. Agarwal to shed some light on how exactly does it work.
See, yoga, basically when we talk about modern medicine, we talk about two systems, sympathetic and parasympathetic. Okay, a shift from sympathetic to parasympathetic lifestyle is yoga in modern medicine language. So it correlates everything with modern medicine. In modern medicine, the only medicine which works to reduce mortality is beta blocker. So yoga is a natural way of acquiring beta blocker in the body. I'll give you two simple examples. क्योंकि योग हिंदी में होता है तो मैं हिंदी में बात करूँगा कि जब भी मेरे शरीर में चोट लगती है तो जो आवाज़ निकलती है वो आह ई उह ए आउच. The always you will have a vowel, swar. Vowel chanting produces interleukin 2, which is 200 times more stronger than an aspirin. So whenever there is a physical pain, body will produce a vowel which will give you a natural painkiller. Whenever you are disturbed, you weep. When you weep, the body relax, the mind relax, and the weeping sound is nasal consonant. Ma na ga na 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 ga. So these are weeping sounds. They produces tranquilizers, the delta activity in the EEG, which is a tranquilizer effect. Therefore, chanting of Om, Aim, Amin, Amin, Hong, Ong, every spiritual sound is a combination of a vowel and a nasal consonant, and they produces aspirin and a benzodiazepine together. So physical and a mental healing together. Therefore, they are scientific as far as parasympathetic mode is concerned. So you can shift from sympathetic to parasympathetic mode using these sounds. And the second thing I'm going to give you a classical, every household. The whole description of Ashtanga Yoga in terms of Yam, Niyam, Asan, Pranayam, Pratyahar, Dharana, Dhyan, Samadhi, you can understand by K.K. Agarwal ki Ramayan. If you understand the whole concept, our body is made up of 5 elements. जो element दिखाई देता है वो पृथ्वी, पृथ्वी की पुत्री सीता, तो मेरा शरीर सीता. अगर मेरा शरीर सीता तो आत्मा मेरी राम, दोनों को मिलाने वाला लक्ष्य माइंड, माइंड विद डिटर्मिनेशन, लक्ष्य बन. तीनों इकट्ठे तब होंगे जब मेरी 10 इंद्रियां कंट्रोल में होंगी. इंद्रियां चंचल होती हैं, चंचल घोड़े होते हैं, 2 घोड़ों को रथ बोलते हैं, 10 घोड़ों के रथ को दशरथ बोलते हैं. तो मेरे शरीर में इफ आई कंट्रोल ऑल माय 10 सेंसेस, माइंड बॉडी सोल विल बी टुगेदर, नो लाइफस्टाइल डिसऑर्डर. लाइफस्टाइल डिसऑर्डर के लिए मुझे 5 विकृतियां चाहिए, काम, क्रोध, लोभ, मोह, अहंकार. काम मीन्स केकई, लोभ मीन्स मारीच, अहंकार मीन्स रावण. तीनों में से एक भी नहीं था तो लाइफस्टाइल डिसीज नहीं, यानी कि रामायण नहीं. काम से क्रोध पैदा होगा, काम जब आएगा यानी कि केकई, दशरथ इंद्रियां मरेंगी. काम से क्रोध पैदा होगा तो लक्ष्मण शूर्पणखा की नाक काटेगा. अहंकार, रावण आएगा. लोभ यानी कि मारीच को भेजेगा. मोह पैदा होगा तो अहंकार यानी कि रावण मेरे शरीर को कंट्रोल करेगा. इफ माय बॉडी इज कंट्रोल्ड बाय अहंकार, देन आई गेट ऑल लाइफस्टाइल डिसऑर्डर्स. माइंड एंड सोल घूम रहे हैं इधर इधर. Now to win over अहंकार, मन बुद्धि अहंकार, to win over अहंकार, सबसे पहले मुझे अपने माइंड को कंट्रोल करना है बाय पैरासिम्पैथेटिक ब्रीदिंग. अपने अंदर के हनुमान को पैरासिम्पैथेटिक ब्रीदिंग से कंट्रोल करके सारी थॉट्स जो बंदरों की तरह फुदकती हैं कंट्रोल करूंगा, वानर सेना को. फिर इंटेलेक्ट यानी कि सुग्रीव को, वाली यानी कि लस्ट को, कॉन्शियसनेस यानी कि राम से, प्रत्याहार यानी कि पीछे से मार के जब मैं अपना मन लगा के काम करूंगा तो सबसे पहले मेरा तमस यानी कि कुंभकर्ण मरेगा मेरे शरीर का, फिर मेरा रजस यानी कि मेघनाथ मरेगा, फिर मेरा अहंकार यानी कि रावण मरेगा. तब मेरे शरीर में सात्वा यानी कि विभीषण वापिस आएगा. राम, सीता, लक्ष्मण इकट्ठे होंगे. लाइफस्टाइल डिसऑर्डर्स का रिवर्सल हो जाएगा. एंड लाइफस्टाइल डिसऑर्डर को रिवर्सल करने के लिए मेरे को हनुमान को अपने साथ ले जाना पड़ेगा क्योंकि वहां पे दशरथ मेरे साथ नहीं है. तो हनुमान रिप्रेजेंट्स पैरासिम्पैथेटिक ब्रीदिंग. Parasympathetic breathing is slower and deeper breathing. So if I want to adopt in my modern medicine, one thing from yoga is a parasympathetic lifestyle and a parasympathetic breathing. And by adopting parasympathetic breathing, which is a natural beta blocker, I can reduce mortality and morbidity. So modern medicine has no absolutely is synonymous with yoga and meditation.
My God, that is incredible.
Time was short, therefore I was very fast.
I just can say just wow. The most important individual in these discussions is obviously the patient. That's what we are all here for. And we have one of our most eminent teachers in our country who's sitting on my right, Dr. Narottam Puri, who's not going to speak as a medical teacher, but he's actually going to speak as a patient and his own life-changing moments of adopting and embracing traditional medicine. Dr. Puri.
After listening to KK, Ram must be wondering why the hell did I do MCH? Well, unlike the proverbial question, what does a woman want, to which no answer or satisfactory answer has still been found, it isn't difficult to say what does a patient want. And it's shocking that there are hundreds of books about what does a woman want, but not a single one that I've read which depicts what does a patient want. Fundamentally, if I look at it as a patient, the patient wants relief. Relief from pain, discomfort, disfigurement. He wants to live. He wants to survive. In most of the cases, the patient in such situations isn't bothered about what pathy is going to make his disfigurement go away, his pain disappear. It is the practicing doctor that he goes to who decides what pathy he is going to be subjected to. There was a time when religion was strong and science was weak. And that time, men mistook medicine, magic for medicine. Now when science is strong and religion relatively weak, men mistake medicine for magic. That is the unfortunate reality of today. In my personal case, I have taken and continue to take recourse to three systems of medicine that I'm familiar with. Allopathy, because that's what I was taught. That's what has given me a lot of succor and relief. Ayurveda and homeopathy. Why? I'll explain. The average life expectancy in India is somewhere around 67. I've crossed that quite substantially. And quite obviously, something has worked. Some of these pathies have worked. By the way, does anybody know who gave the name allopathy to modern medicine? Anyone? A guess? Who named modern medicine allopathy? It was actually the father of homeopathy, Samuel Hahnemann. So the real thing is that in my personal case, I wouldn't be alive today if allopathy or modern medicine wasn't there. At the age of 50, I had a bypass surgery done. I've had 8 angiographies. 4 stents are in me at the present moment. And that wouldn't have been possible if modern medicine wasn't there. As someone who studied, trained in, and taught and practiced modern medicine, and as someone who's benefited immensely from it, it may come as a surprise to you that I still believe that there is space for alternative medicine or traditional medicine or whatever you may like to call it by whichever name. And there are several reasons for it. I've realized over a period of the 5 decades that I've been in medicine that there are limits to everything. Good doctors very often know when to treat, when not to treat, when to give which medicine, and why. The trouble is that a large number of people who say that they are doctors of whichever pathy that they may be practicing in, they start wanting to believe that they can cure everything. So you have these tall claims of vitiligo disappearing by a particular method, or cancer disappearing by a particular method, usually they are probably retired railway clerk who's got some kind of a practice going because to while away his time. I believe very firmly that integrated medicine, as has been discussed, both at the government level by our gentleman friend who started this discussion and my colleagues, has a place. The reason is that good allopaths will know that whilst we may be good in treating acute infections, in doing surgical treatments, but we are absolutely lousy in managing chronic conditions. Let's also admit that we usually fail in most what we call allergies. Now, this is where I think the integrated or Ayurvedic or homeopathic medicines score, because they somehow have a way of finding out what will work in your case. The second thing is that majority of chronic conditions, what we can offer in allopathy or in modern medicine are usually painkillers. And we all know that long-term use of painkillers produces side effects. So is there a place where all these could mesh together? Gentlemen, you've heard these gentlemen talk about it. If Ayurvedic medicine wasn't there, Harish asked me in the session that we were having before that, when was the first medical college opened? And I said, as far as I remember, somewhere in the 1878, it was the first modern medical college, was Bengal Medical College in Calcutta. So he said, when Clive came to India, who was treating the Englishmen prior to that, or who was treating Indians before that? Obviously, the traditional method of treatment or Ayurveda must have been the way that they were taking their medicines. In allopathy or in modern medicine, as surgeons and as physicians, we all owe a debt of gratitude to two Ayurvedas, Charak and Sushruta. Sushruta is considered the father of plastic surgery. And in many ways, the cat's paw retractor that we use, Ram uses routinely, actually was designed by Sushruta. Most of the instruments you see in cesarean sections were designed first by Sushruta. So there is a fundamental basis of many of these things. The reason why I think many of these specialities have got left behind is because I think they've failed to keep up with the times. I think, as Rajiv mentioned, you've got to move ahead and be aware that this modern generation wants what it wants. It wants proof. That's number one. This is where I think allopathic medicine has understood the pulse of the people. Because if they give you medicines which cause side effects, they know that this side effect occurs because of this medicine. But in many instances in homeopathy and Ayurveda, and I can give you personal examples where I was never told and I didn't expect that a side effect will occur. Just two examples. My son, who is today 43 years of age, he is a doctor in the United States. When he was young, he had a terrible, what was labeled by the dermatologists here as eczematoid skin lesions. So steroid ointment was applied, it would disappear, it would come back again. 4 or 5-year-old kid. So we were told to take him to a homeopath. We took him to a homeopath. The homeopath gave him some medicine, and the eczema, instead of disappearing, actually spread up to his waist. The leg swelled up, we had to rush to the emergency, steroid injections were given, and I was given a lecture by my professor of dermatology, what an idiot you are. How did it help? And KK will be interested in finding out. I have no explanation for it. If any of you have, please let me know.
That's the principle of homeopathy. It will increase.
No, it might increase, but nobody told me that it will. The second thing is, I took him for the first time to Bombay, and at Juhu Beach, the most polluted part, Ashok and Ram would know more, in Juhu Beach, for the first time, he set foot inside the sea as an excited young boy. At that time, he could not wear a shoe. He was in a Hawaii chappal. He left the Hawaii chappal and walked into the sea. For an hour, he frolicked in the sea. When he came back, no eczema. Till date, he's 43, a pulmonologist, critical care guy in USA. No eczema, touch wood. How do we explain it? I have no explanation. So is it magic? Is it the seaweed in the sea? Was it sea salt? Maybe there is a natural way that it healed itself. God alone knows. In homeopathy, another example that I always remember is, I was a senior resident, or in our days we used to call them registrars, in Irvine Hospital, which is a very busy place. A 12-year-old boy was brought in and required a tracheostomy. An incision had to be made to open his airway. I was on duty. I went and did a tracheostomy. I found out the history. He had been given a homeopathic medicine for seizures. And it resulted in such a reaction that he had to be tracheostomized. My blood boils when people practice beyond their means. What I can't do as a GP, I must refer to my senior, to my specialist. When I can't treat by allopathy, I must go to my colleagues in Ayurveda or in homeopathy. But I need proof that this works. This is where I think homeopathy and Ayurveda still need to do a little more to convince the modern generation. But in my mind, and I don't need any evidence for it because it's self-tried, I still took my Ayurvedic medicine in the morning, along with all the cardiac medications, allopathic medicines that I take. Because I firmly believe that in certain cases, they are much better and cause less side effects. I only wish my Ayurvedic doctor had realized that when he gave me that medicine, he had told me that this also contains heavy metals. And heavy metals are not good for any cardiac patient, as KK or Ram will tell you. So I think that's where the dialogue that Ram mentioned about needs to be needs to come in. I also feel very strongly that when it comes to collaborative medicine, I feel there is a much greater use of it to a patient. And I'm coming only as a patient here. We really, once upon a time, it used to be said that the job of a doctor is to humor the patient while nature cures the disease. I think it was Voltaire who said it. And then Molière came around and he said that nearly all men die not of their disease, but of the medicines that they take. Alexander the Great, when he was retreating from India, his comments when he lay on his deathbed was, "I think I'm dying from the treatment of too many physicians." So I don't want patients to suffer because these patients, these doctors, homeopathy, allopathy and various other pathies continue to experiment on it. If you need to actually find evidence in every which way. In allopathy, we were taught what were called Koch's postulates. And Koch's postulates are 4, and they basically mean that they are replicable model of etiopathogenesis and treatment. I firmly believe that, like Benjamin Franklin said, he's the best physician that knows the worthlessness of most medicines. At the end of the day, we have to come to a situation where, as a patient, I am given, number one, enough confidence that this is the way forward for you, and I'm given the choice to accept or reject that treatment. 2, as a patient, what I want is that I'm told that this is a likelihood of this particular medicine causing such and such side effect, and if so, what needs to be done. I also need to be told the limitations that need to be imposed, because if I go to if I have stage 3 cancer or stage 4 cancer, which requires surgery plus chemotherapy plus radiotherapy, complementary medicines have probably a bigger role to play in making my end stage better. But if I have a vocal cord cancer, grade 1, and somebody tells me I'll give you a homeopathic medicine and it disappear, whereas radiotherapy or surgery is going to cure him, then I'm sorry, that's the wrong advice that I'm getting. Well, as I told you, as a patient, I made the choice that in certain conditions, I will believe in modern medicine. In certain conditions, I will not believe in modern medicine because it produces either side effects or doesn't have anything more to offer than pain relief. I will take allopathy, Ayurvedic medicine or homeopathy. But I only hope that over a period of time, there will be greater integration, as is occurring now as we talk. All India Institute actually is collaborating with an Ayurvedic institution for management of cancer, particularly in alleviating pain and in relieving the side effects of many chemotherapeutic drugs. Because of the advances in treatment, I have lasted 70 years. I intend to be with you in the next FICCI Heal, and I'm not going to blame either Ayurveds or modern medicine people if I'm not there with you. I think that will be destiny. But the important point that I want to leave a message with is decide for yourself. Don't go by one pathy or the other. If you're an informed patient and if you have rights as a patient, you also have responsibilities. We talk a lot about the rights of patients. Nobody talks about the responsibilities of the patient. One of the responsibilities of the patient is to be well informed. If this roof were to fall down on this panel and we had cuts, bruises and fractures, what would you give me, a homeopathic medicine? Would you give me an Ayurvedic poultice? No, you'll take me to the trauma center and set my fracture. And then the other specialties will come. So that is the limitation. And that you must know. Let this panel or any other panel not sway you this way or that way. Each specialty has a role to play, but we have not fully explored the role that the limitations imposed by each specialty have on each other. We have not explored that at all. I feel that alternative medicine is a way forward for a country like India, and an integrated model will need to emerge from more discussions such as this.
Thank you, Dr. Puri. So his take-home message for all of us is that, to use the Sanskrit word, we all need to be Buddhijeevis. If the moment we claim to be Buddhijeevis, we become more aware of what are the options or choices which we make. Thank you, colleagues. We don't have time for questions, unfortunately. It's just us, stopping all of you from lunch. So thank you all for your patience. To all of us, thank you.
I just want to add one word to Dr. Puri, that you says you are taking homeopathy, allopathy and Ayurveda. Please add parasympathetic breathing into it to make it total integrated.
Thank you.
Thank you, panelists. That was very insightful.